Hi, I'm Hitaishi, a certified strength and conditioning coach, and this is my athlete Anushri, who has 5 years of professional cricket experience demonstrating exceptional skills and athleticism in her role as a batting all-rounder. Unfortunately, 3 months ago, she suffered a grade 2 hamstring strain while batting in a match. Following a period of rehabilitations, she is now in the final stages of recovery, preparing to return to competitive play. Today, we'll be conducting a series of tests to assess your movement competence and readiness to return to full cricket training. Given her recent hamstring strain, it is crucial to ensure that her flexibility, strength, balance and proprioception are at optimum level to prevent re-injury and support her from performance. We'll be starting with active straight leg rest, followed by star excursion balance test, and finally single-leg glute bridge test. Let's begin the test now. The active straight leg raise test evaluates hamstring flexibility, range of motion, and core stability. It helps identify limitations that may affect performance and increase injury risk, particularly when the flexibility of biarticular hamstring muscles is compromised. To test athlete hamstring range of motion, we require a marking tape to mark a 70 and a 90-degree angle on the wall. The athlete lies supine by placing their hip over the greater trochanter at the fulcrum of the 90-degree vertical line, while both legs are fully extended on the floor. Now, the athlete keeps the non-tested leg firmly on the ground and raises the tested leg slowly as high as possible to the maximum range without bending the knee. Now I'll demonstrate. Arms facing down, ankle dorsiflexed without raising in the supine position. Try and lift both the legs 3 repetitions. Now athlete will begin the test. Slightly come down. Yeah, palms facing. Yeah, don't lift this. If you could make out, there was minimum difference with her left and right leg with her hamstring flexibility. Leg length. The athlete's leg length is measured by athletes lying supine on a table. The athlete moves inferior aspect of each anterior superior iliac spine is located and marked. The most distal portion of each lateral malleolus is then located and marked. Then the athlete lifts the hips off the table and assessor passively straightens the leg to equalize the pelvis, and then the athlete's right and left limb length is then measured from the anterior superior iliac spine to the most distal portion of the lateral malleolus with the measuring tape. Let's begin the test now. Steady breathing. The star excursion balance test is used to assess dynamic balance and proprioception in the stance leg as well as bilateral asymmetries. To facilitate the measurement, we have marked a star pattern on the floor with 8 vectors standing from the center point. Each is separated by 45 degrees. In this test, athletes stand at the center of the grid, hands on the hips, and complete the test in the following order: anterior, diagonal, medial, posterior, posterior lateral, lateral, and anterior lateral. By reaching as far as possible along each vector with the non-stance leg, slightly taps the line and return to the center without losing the balance. Athlete performs 3 trials with both the legs. The greatest distance of 3 correctly completed trials for each direction is considered for the analysis. Now let me demonstrate for the athlete. Hands on the hips. Now, athlete will begin the test. The single-leg glute bridge test assesses the strength and endurance of the gluteal and hamstring muscles. The gluteal activation test determines the athlete's lower body strength and identifies any weaknesses or imbalances. For this test, we require a standard treatment table and a box. Athlete lies supine on the bench with the knee flexed at 90 degrees while having feet placed lower than the supine body and arms across the chest. Athlete performs the glute bridge by placing one leg on the box and extending the other leg. Athletes then lift the hip towards the ceiling while maintaining a straight alignment from shoulders to the knee and lower the hip back to the starting position without glutes touching the table and performs the next repetition. The athlete tried to perform 20 repetitions with both the legs to clear the test. Let me demonstrate now. Spine position. Arms across your chest. Try and lift your glutes towards the ceiling. Get your single leg on top. Lower down and lift up. Without touching the bench, you will do the other repetition. Okay. Now, athlete will perform the test. Lower your down, leg straight, then lift your hip. Avoid arching your lower back. Athlete performed with both the legs by doing 20 repetitions and showing excellent strength and endurance with slight noticeable imbalance. Very well done, Anu. We have completed all 3 tests and you have completed it successfully. These 3 tests are reliable and valid assessment as these tests provides critical information for developing and monitoring the rehabilitation programs. Therefore, these tests are crucial for the thorough assessment and essential for accurately identify leg imbalances and potential risk factors for the lower extremity injuries, ensuring a comprehensive evaluation of the athletes and readiness to return to play. Thank you.